The word psychopath often conjures up images of Hollywood villains and notorious criminals. We picture Hannibal Lecter, a brilliant psychiatrist with a taste for human flesh, or Patrick Bateman, a Wall Street tycoon leading a double life as a serial killer. While these fictional portrayals can be chillingly accurate, they only offer a glimpse into the complex reality of psychopathy. Psychopathy is not a label we throw around lightly. It's a serious personality disorder, characterized by a distinct lack of empathy, remorse, and guilt. Psychopaths often display superficial charm, manipulativeness, and a disregard for social norms, making them both intriguing and terrifying. There is a distinct difference between someone who is simply eccentric or difficult, and someone who meets the clinical criteria for psychopathy. It's important to remember that not all psychopaths are violent criminals. In fact, many live seemingly normal lives, holding down jobs, raising families, and blending seamlessly into society. This makes identifying them even more challenging, as they often excel at disguising their true nature behind a mask of normalcy. Understanding psychopathy requires us to look beyond the sensationalized headlines and delve into the intricate workings of a mind wired differently. Imagine a world devoid of empathy, where the suffering of others evokes no emotional response. This is the chilling reality for individuals with psychopathy. They lack the ability to genuinely connect with others on an emotional level, seeing people as pawns to manipulate rather than individuals deserving of compassion. One of the defining characteristics of psychopathy is a profound lack of remorse or guilt. They can inflict pain and suffering without a flicker of conscience, their actions driven by self-interest, and a cold detachment from the consequences. This absence of a moral compass allows them to engage in deceitful and manipulative behavior without experiencing the emotional turmoil that would cripple most individuals. Psychopaths are often described as charming and charismatic, able to effortlessly draw people in with their superficial charm and captivating persona. They possess an uncanny ability to read others, identifying vulnerabilities and exploiting them to their advantage. This manipulative prowess allows them to gain trust, influence decisions, and control situations to suit their needs. Another hallmark of psychopathy is a grandiose sense of self-worth. They have an inflated view of their own importance, believing themselves to be superior to others and entitled to special treatment. This sense of entitlement, coupled with a lack of empathy, fuels their manipulative behavior and justifies their disregard for rules and social norms. Imagine a world devoid of empathy, where the suffering of others evokes no emotional response. This is the chilling reality for individuals with psychopathy. They lack the ability to genuinely connect with others on an emotional level, seeing people as pawns to manipulate rather than individuals deserving of compassion. One of the defining characteristics of psychopathy is a profound lack of remorse or guilt. They can inflict pain and suffering without a flicker of conscience, their actions driven by self-interest and a cold detachment from the consequences. While not every individual displaying these behaviors is a psychopath, recognizing the following red flags can serve as a warning sign to proceed with caution. Pathological lying. Psychopaths are notorious liars, weaving elaborate fabrications with ease and showing no remorse when caught. Their lies often serve a specific purpose: to manipulate, deceive, or gain something they desire. Impulsivity and risk-taking. Living on the edge is a way of life for many psychopaths. They engage in reckless behavior, seeking thrills and instant gratification without considering the potential consequences for themselves or others. Lack of responsibility. Blaming others for their mistakes and failing to take responsibility for their actions is a common theme with psychopaths. They are masters of deflection, shifting blame and avoiding accountability whenever possible. Superficial charm and glibness. Psychopaths can be incredibly charming and charismatic, but it's a superficial charm that lacks depth and genuineness. They are skilled at manipulating their outward persona to impress and disarm others. Parasitic lifestyle. Some psychopaths adopt a parasitic lifestyle, relying on others for financial support, emotional validation, or a place to live. They exploit the generosity of others, often leaving a trail of broken relationships and financial ruin in their wake. Developed by renowned Canadian psychologist Dr. Robert Hare, the Hare Psychopathy Checklist Revised, PCLR, is a widely used diagnostic tool for assessing psychopathy in individuals. This comprehensive assessment delves into the intricate workings of the psychopathic mind, evaluating 20 distinct traits that characterize this disorder. The PCLR is not a self-assessment tool. It requires a trained professional, typically a forensic psychologist or psychiatrist, to administer and interpret the results. Through a combination of in-depth interviews, behavioral observations, and a review of the individual's history, the clinician assigns a score for each of the 20 traits. These traits, which include glibness, superficial charm, grandiose sense of self-worth, lack of remorse, impulsivity, and criminal versatility, provide a comprehensive picture of the individual's psychopathic tendencies. The higher the score, the more likely the individual is to exhibit psychopathic traits and engage in antisocial behavior. It's important to note that the PCLR is not a foolproof method for diagnosing psychopathy. It is a valuable tool that, when used in conjunction with other assessments and clinical judgment, can provide valuable insights into an individual's personality and potential for dangerousness. Contrary to popular belief, not all psychopaths are lurking in the shadows, committing heinous crimes. Seemingly ordinary lives, blending into society and holding positions of power and influence. High-functioning psychopaths possess a lack of empathy and manipulative tendencies, but adapt to societal norms. Professions requiring charisma, ruthlessness, and emotional detachment. Their charm and manipulative skills help them climb the corporate ladder. Others gravitate towards politics, law, or surgery, thriving. Danger lies in their ability to mask their true nature. They mimic emotions, feign empathy, and manipulate situations for their own interests. Their ability to blend in makes them difficult to identify. Crucial for protection. Awareness of these traits helps navigate relationships with caution. The world of psychopathy is not easily categorized. While some individuals with this disorder exhibit high levels of functionality, excelling in their chosen fields, and maintaining a veneer of normalcy, others struggle to adapt to societal expectations, their lives marked by impulsivity, recklessness, and a constant disregard for rules. This dichotomy within the realm of psychopathy has led to the distinction between high-functioning and low-functioning psychopaths. High-functioning psychopaths, as we've explored, are often able to control their impulses, maintain stable relationships, albeit superficial ones, and achieve a certain level of success in their personal and professional lives. They possess a higher degree of behavioral control, allowing them to navigate social situations with greater ease and manipulate others to their advantage. Low-functioning psychopaths, on the other hand, struggle to contain their impulsive urges and often engage in risky behavior that leads to negative consequences. They may have difficulty holding down jobs, maintaining stable relationships, or staying on the right side of the law. Their lives are often characterized by chaos, instability, and a trail of broken connections. It's important to remember that the distinction between high-functioning and low-functioning psychopathy is not always clear-cut. There is a spectrum of functioning within this disorder, and individuals may exhibit traits of both high and low functioning at different points in their lives. The question of whether psychopathy can be treated is complex and often debated. Unlike some mental health conditions, psychopathy is deeply ingrained in an individual's being. However, there is hope in early intervention programs targeting children with callous traits. Addressing these traits early can foster empathy and prosocial behavior. Cognitive behavioral therapy has shown promise in treating specific aspects of psychopathy. While not addressing core deficits, CBT helps manage impulses and improve interpersonal skills. It's crucial to approach interventions for psychopathy with cautious optimism. In a world where psychopaths walk among us, often hiding in plain sight, the importance of awareness cannot be overstated. Educating ourselves about the traits, behaviors, and manipulative tactics associated with psychopathy empowers us to protect ourselves and others from potential harm. Knowledge is our greatest defense against the manipulative charm and calculated deception that often characterize this disorder. By recognizing the red flags, trusting our instincts, and setting healthy boundaries in our relationships, we can mitigate the risk of falling prey to the manipulative tactics of a psychopath. It's equally important to remember that not everyone displaying psychopathic traits is a danger to society. Many individuals with this disorder never engage in criminal behavior, and some even contribute positively to their communities. However, understanding the potential risks associated with psychopathy allows us to approach all our interactions with a healthy dose of caution and discernment. Awareness is not about living in fear or suspicion. It's about empowering ourselves to make informed decisions, set healthy boundaries, and protect ourselves from those who would exploit our trust and compassion for their own gain. Psychopathy, a complex and often misunderstood personality disorder, challenges our perceptions of good and evil, normal and abnormal. It is a disorder that defies easy categorization, with individuals exhibiting a wide range of functionality and behavioral patterns. While the sensationalized portrayals of psychopaths in movies and literature may capture our imaginations, it is the subtle signs, the chilling lack of empathy, and the calculated manipulation that often go unnoticed, lurking beneath the surface of seemingly ordinary individuals. By understanding the core traits of psychopathy, recognizing the red flags, and educating ourselves about the potential risks, we can better protect ourselves and others from the manipulative charm and calculated deception that often characterize this disorder. Awareness is not about living in fear, but about empowering ourselves to navigate a world where psychopaths walk among us, often hidden in plain sight. It is about recognizing the faces of psychopathy, not to demonize or ostracize, but to understand, to protect, and to foster a society that is both informed and compassionate.